Hello everyone, good evening everybody. I am Sania, your host from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans, right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat and humidity increases risk of damage due to UV rays, which make skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles as well. According to surveys, 67% of people in India are not using sunscreen as a daily skincare routine. Several things about sunscreen that we people are not aware and that makes us not including sunscreen as an integral part of our skincare routine. So to keep you informed today, we are here to know about sunscreen in skincare regime. Premature aging is no different. Proper skincare routine, which majorly includes sunscreen, will help in preventing premature aging. So let's connect today with our skin expert, Dr. Shafali Yadav from Lucknow, on the topic of sunscreen in premature aging. Dr. Shafali Yadav is one of the most prominent and renowned dermatologists in Lucknow, having more than 17 years of clinical experience. She has sharp clinical acumen and offers latest treatments for skin problems. Dr. Shefali Yadav did her graduation MBBS and post-graduation MD Skin and VD from Jamnagar, Gujarat, from Sri MP Shah Medical College. She did her observership course in cosmetology in Nanavati Hospital under Dr. Kalpana Sarangi MD and fellowship in dermatosurgery in Safdarjung Hospital, Delhi under Dr. Neeti Kungar MD and DNP. She has many research publication, awards, and fellowship under her name during her clinical experience in the field of dermatology and has a holistic approach towards patient care and well-being. She has presented papers in national conferences and international conferences as well. Dr. Shifali, a very warm welcome to you.
Thank you.
And as today we are going to talk about sunscreen in premature aging, and as so many people in India do not include sunscreen as their major skincare routine, my first question would be why it is necessary or why one should wear sunscreen every day.
See, actually, if you want to explore that area, then one should be knowing that what causes aging. So everybody, everything in this planet is actually aging with time. So here, when we talk about the skin, a major factor which causes aging is damage by ultraviolet radiation from sun. And most of the people, they think that ultraviolet radiation is what we see. जो धूप होती है, that is ultraviolet radiation. It's not that. That's the visible spectrum of the light, and ultraviolet radiations cannot be seen by humans. So, since ultraviolet radiations are one of the major factors in skin aging, sunscreen becomes of imperative use that one has to use sunscreen to reduce the rate of aging. So, we all know that aging is happening, but to accelerate it or to retard it is actually within our hands. Okay. So that is why I think it's very much imperative that one should always wear a sunscreen, especially when they are going out.
Yes, and I think people sometimes feel that aaj dhoop nahi hai, there is no sunlight, so we should apply sunscreen, and applying sunscreen before then it's a time taking thing for them. But as the doctor said that UV rays are not visible to us, so and we should apply sunscreen. Doctor, when we buy a sunscreen, usually we see SPF level. So many people see SPF level 30 or 35 or 40. So what is basically when we talk about SPF, what is basically it means and why we should know that that particular SPF must be applied to our particular skin?
See, SPF basically means sun protection factor. Okay. So ultraviolet radiations are also divided into two parts. There is an ultraviolet A and ultraviolet B. When we talk about SPF, we are talking about how much protection that sunscreen can give regarding ultraviolet B. Okay, now recommended part is that a person can easily apply, from SPF 15 to 50. Okay, one can go higher also, but then you have to understand that what does an SPF 15 does? It uh, reduces the effect of 93% of ultraviolet B rays falling on the face or any part of the exposed part of the body. And as the SPF, now you can understand that if 15, SPF 15 means 93%, how far is it from 100%, right? So as the SPF increases, the amount of protection actually doesn't increase proportionally. So an SPF 50 will protect 93% and SPF 50 will protect 98%. So now you can understand if you go higher than 50, then it only increases the cost. It is basically a marketing and a publicity gimmick. It doesn't give any objective benefit. Okay, so I would say that you can just always buy something between SPF 15 to 50.
Okay, so SPF 15 to 50 is a good amount, we can say, the SPF
It's a good
protection.
range.
It's a good range. People can buy it and then apply it to any exposure part of the body. Doctor, sometimes people don't know that how much quantity one should apply the sunscreen on their face or on their hands or on their legs if they are going out for vacation. No. So how much quantity one should really apply on their face, especially, and on hands and legs?
See, here there are two things. There is something called how much theoretically should be applied. And we all know that sunscreen is something we apply by choice. So the most important thing which has to be taken care of is, are you comfortable after applying it? So typically, when I am advising my patient, I just tell them, इतना लगाओ कि लगाने के बाद लगे मैं तो और तो नहीं लगा सकता. So the patient laughs off. But I typically mean that you have to apply that much amount after which it feels comfortable, yet you have applied a lot of it, and you do not feel aesthetically incompetent. For example, I have seen people, they would appear totally white, just say, that as if they have painted their faces white. So it should be cosmetically applicable. The patient should be comfortable. They shouldn't be feeling very suffocated कि क्या लगा लिया. And at the same time, उतने limit में जितना लगा सकते हो लगा is the thing which is practical. Otherwise, if I tell you कि 2 gram, peanut size, chammach bhar ke, it is all impractical.
Right. And as you said, sometimes people apply more of it. And there is a proper technique of applying sunscreen as well, right? Like if it is white, they have to put it in a moisture and then apply it. Is it like that? There are types of sunscreen as well?
See, there are many types of sunscreen. It's available in gel, emulgel, then matte finish, skin tint, there are sticks, there are sprays. So one has to find which one has to be applied. That depends upon what kind of skin the person has. Now, there would be many people who would say, "Arey, mujhe to yahi nahi pata chalta ki skin kaisi hai." Okay, no problem. Then you have to see that, is your face usually dry? And how does one find out that the face is usually dry? When you're speaking or when you're opening your mouth, there's some kind of stretchiness which a person feels. If there is no stretchiness, that means the skin is not feeling very dry. Okay, then you can apply a sunscreen which is matte finish. Okay, if a person feels that हमेशा ही मुंह पे तेल छाया रहता है, तो तभी भी matte finish लगा सकते हैं. But if the person feels कि मेरा face बहुत सूखा रहता है, then a moisturizing sunscreen is of value, because you do not have to then apply a moisturizer first and the sunscreen second. So in that case, a moisturizing sunscreen can be chosen and it will serve both the things.
Okay.
And the thing you asked, that how much to apply on hands and face. See, on hands or on the upper limbs, the compliance factor would be like कितना भी लगा लो इतना बुरा नहीं लग रहा है. But something we apply on face, no, वो थोड़ा suffocation देता है कि बहुत अजीब सा बंद लग रहा है. तो obviously हाथों पे ज्यादा लगाया जा सकता है, and face पे you can apply as you want.
Okay, as much you're comfortable
yes.
With it.
But try to apply in a higher amount.
Higher amount is always better.
Yeah.
Okay, and doctor, as you told us about, that if somebody have oily skin, that a different type of sunscreen can use it. If you have a dry skin, then you can use different type of sunscreen. So, how is the effectiveness? We can say, that sunscreen is usually measured that this has effectively worked on someone.
So that is an objective measure, this SPF factor. It is something like आप 1 किलो iron ले लो और 1 किलो cotton ले लो, वो कितनी है? 1 किलो ही है, right? It might look different, but if the SPF is same, okay, it is between 15 to 50, and then everything would work same. The only difference would be how would it feel on your skin. Now, the one thing is very important is that whatever be the SPF between this, you have to apply a good amount, because sunscreen, basically, I just want to tell you how does a sunscreen work. There are two types of sunscreens. There is a chemical sunscreen and there is a physical sunscreen. The chemical sunscreens, they have chemicals. When the ultraviolet rays fall on the face, they change the frequency or the wavelength of that ray, and they change the character of that ray. Okay. So for that, it has to be there on the skin in some quantity which is able to do that job. There is a physical sunscreen. Physical sunscreen is made up of some particles which scatter that light. It doesn't let it penetrate. So again, for something which has to work, it should be available in that quantity. So the amount of sunscreen which has to be applied is of prime importance in everything. Okay.
And someone has to apply a good amount of sunscreen.
Yeah.
By that means, it's not like that, only one pinch of sunscreen on your face will not work.
It's not done. It won't work.
It won't work. A proper amount should be applied on your face, on your hands, or any part of your body which is exposing to the sun, right?
Yeah.
Okay. And is there any different sunscreen for premature aging as well? Like, if someone can apply that particular sunscreen.
See, it depends upon premature aging. What is premature aging basically? See, if the person is too much sun exposed, so there would be some professions who are field jobs, and there would be professions in which one has to commute. So the requirement is different. So I would say that those people who have a field job in which they are constantly exposed to sun. So in these cases, there are some very resistant sunscreens which are very resistant to sweating and rubbing and even washing. So these are those used by sports people. There are certain sunscreens which are available as sports. Okay. Those are very good because they do not give away very fast. So it is very imperative. See, if a person is out in the sun, obviously they are sweating. When a person sweats, what do? Either they keep on wiping it. So obviously the sunscreen will also be wiped off. So so as we discussed, the thickness has to be there, the thickness of that layer, so it will be washed off. So in the cases of lot of field work, a sunscreen which is dedicated to either swimming or sports is very much effective because it will not wear off very soon. In other cases, a normal medicated sunscreen would do. I mean, I have seen in my clinical experience that the cosmetic sunscreens, they do not work. Somehow they do not work. So sunscreen has to be a medicated one. They really work nicely.
Yes, and one has to select a sunscreen for themselves very crucially. That this will work when if you are having, as doctor said, if you are having professional field work or sports or anything where you are exposed to sun more often, you should definitely apply the medical sunscreen, as doctor said. Doctor, when we were talking about premature aging, is it like that any age group is considered in premature aging, that this particular age group will have early aging, or is it like that?
See, let's see. First, let's explore what do we mean by aging? So aging is basically a change which is going towards degeneration. And this is for everything. This is for clothes. This is for any non-living or living. For example, you must have seen कि कोई नई चीज खरीदी कभी यूज नहीं की, लेकिन जब यूज करने के लिए उठाई, then it was already broken or it just gave away. So everything has a life. Okay. Now premature aging is basically when a person is of some age and they are looking of older age. Okay, that might be because of the body habitus. If somebody is very, if they do not look that, so fat might be a factor, etc., etc. So एक तो हो गया body habit, जैसे आपको देख के कैसा लगता है वो बंदा कितने years का होगा, एक होता है उसकी skin देख के कैसा लगता है कि कितने years की होगी. So premature aging would be labeled in any age group a person who, because of the skin parameters, looks or feels way more than what he is actually of chronological age. Chronological age is कि मेरी age इतनी हो गई है. Okay. That is chronological age. तो देखने में जो ज्यादा बड़ा लगे स्किन की वजह से, तो that is premature aging, and that can happen basically बच्चों में तो नहीं होती, because we know that the aging usually doesn't start till 25 years of age. So उसके बाद anybody, and it always depends upon the lifestyle, how much the person drinks and smokes and exercises, what kind of food is consumed, what kind of a personality is he. So ये सब चीजें भी बहुत ज्यादा इसमें factors होते हैं, but yes, a major factor is ultraviolet rays.
Is ultraviolet rays, as you said, UV rays. और कई बार हम देखते हैं कि बहुत सारे, some of our friends as well, especially boys, they usually don't take care of their skin. They don't apply sunscreen, and then they start saying that मेरी skin पे काफी wrinkles आने लगे हैं. So why this is happening? Then they go to a dermatologist that this is something is happening.
Yeah. So sunscreen should be used by everyone.
Yes. Besides, is it like people more often said, that girls usually have a good skincare routine and, boys don't apply. But I think sunscreen should be applied for, the men and women both. Right, doctor?
Yeah, I am such a big propagander of sunscreen that if somebody just says you are going on a planet, of course, where there is sun, and you just have to take one cosmetic, I would just say I would take a moisturizing sunscreen, and that is it. I mean, it is such a good thing for the skin that it really pays dividends. See, what is the difference between a youthful skin and an aged skin? The difference is that the youthful skin is tighter, it is lighter, or maybe it is smoother. It doesn't have spots. Okay, it doesn't have blemishes. So all these things, basically, they are a sign of aging. Okay, and obviously they also tell what kind of a lifestyle is going on and other factors. But cumulatively, they are a sign of aging. So when you use sunscreen, then that the wrinkle part, the fine lines, they come late. Obviously, they cannot be totally erased, but they come late. As I said in the beginning only, that aging is not in anybody's hands, but the rate of aging is actually in everybody's hands.
Definitely. And if we start taking care of our skin from a very young age only, then, as you said, that aging will happen, but thoda sa late hoga, and the rate of aging will be, like late. And we were talking about boys only, and we have a viewer's question. His name is Rahul Batswar, and he's asking, can you tell me about your daily skincare routine? What products do you use and how do you take care of your skin?
Rahul, you would be really shocked at what I do. See, as a dermatologist, I know very well that what makes the skin glow. So let me tell you that what you're seeing on the surface actually is a totally dead skin. So you might have noticed कि कभी-कभी हाथ में कट लग जाता है, बहुत माइनर सा कट होता है, तो वो bleed नहीं करता. Why? Because it's dead. The superficial layer of skin which you see is dead actually. So something, because skin is rejuvenating every day. A good live new layer is coming from inside. And where is it getting the nutrition? From the body inside. So it is something like whatever you have to do, it is not that you have to apply. It is what you have to do in your routine. So if you just focus on skin products, just focus, just mark my words, just focus. Not that if you also focus, if you just focus on skin products, then it will not lead to anything. So my skincare routine, if I tell you my skincare routine, then it is that I exercise daily, that I really eat healthy, that I take care of, I'm not stressed. I do stress, like I do meditation and all. And then I only apply sunscreen. That is it. Because all these things, they are going to make your skin smoother. Any cosmetic is not going to give you any dividends Only, yeah, sunscreen. I always apply sunscreen. Like I apply it religiously. I never ever go out without a sunscreen. That is the only thing. Otherwise, the other things which I do are my lifestyle.
Okay, so the secret of your beautiful skin is applying sunscreen daily and not skipping a day, not applying sunscreen. And as doctor said, that a healthy lifestyle, eating healthy, doing physical exercise can also help you in various ways. Doctor, when we were talking about sunscreen and aging, sometimes because now children also go out. In outdoors. So, what sunscreen are best to use on children or infants? And is it good that children should also apply sunscreen?
Yeah. So, see, the thing is that children, if they are too much into sports and all, then I feel that they should apply. Plus, a person who's going into swimming. So there is, and swimming during the sun hours, जैसे जो sunset or sunrise के बीच के होते हैं. So, sorry, sunrise and sunset के बीच के, they should apply sunscreen. And physical sunscreen is always best for kids. Physical sunscreen means that they do not have any chemicals. They have some physical particles like zinc oxide and titanium oxide, and these things are much better for the kids.
Okay, so it is good that if they're going out for swimming or any physical exercise, they should apply. Are their sunscreen different from when what we use or a particular SPF you suggest, or it is the same 15 to 50 for the children and infants as well?
Yeah, 15 to SPF would always remain same any age, regardless of the age group. But yeah, as I introduced, there is a chemical sunscreen, there's a physical sunscreen. So the physical sunscreen is better for kids.
Okay. Physical sunscreen is better for kids. So if your children are going out, do apply then the physical sunscreen, as doctor said. Doctor, we have already discussed the different type of sunscreen, the spray form, the cream form. So what is the better, I can say, formulation of sunscreen? Is it spray, cream, gel, or lotion? And how one can choose the suitable for individual skin? And is it depend on a particular skin type that this skin type should apply the lotion sunscreen or the gel sunscreen?
See, it's always hit and trial. It's a kind of a cosmetic you should be comfortable in. So it's always hit and trial. For spray sunscreens, you can very well imagine you have to apply it on the face. Imagine spraying something on your face. How uncomfortable it is. At the same time, if a person is has to apply it on their upper limbs, lower limbs, back, या ऐसा कुछ है, तो spray sunscreens are really good because ease of application. एक होता है कि आप बैठ के उसको rub कर रहे हैं, एक होता है कि you just spray, but there is always a window of uneven spraying. उस चीज का ध्यान रखना है. फिर you are asking the formulations. Formulations are actually dependent upon what you like. You have to use, see how does it feel, and if you're comfortable, continue with that. Again, the SPF has to be chosen, and then if you're not comfortable, try it. That is the funda.
Okay, so first apply it, see that it is suiting you, and if it suits you, then continue it on. You can switch to it, right, doctor?
Yeah, and if those people who have a problem of acne, they should kind of choose those sunscreens on which non-comedogenic is written. There are certain sunscreens which would incite an acne eruption. So there are certain sunscreens which definitely are suitable for people having acne. So this also one has to see.
Okay, so this is the thing which you have to keep in mind if you have acne as well. Doctor, we have another viewer question asking how much sunscreen should I use and how often should I apply it?
Yeah, how much sunscreen we've already discussed that you have to apply the maximum amount of sunscreen which you can, and at the same time after application you shouldn't be feeling bad or suffocating or कि ये क्या लगा लिया मैंने बड़ा गंदा गंदा लग रहा है. This feeling shouldn't come. At the same time लगाने के बाद you should be looking fine. ऐसा नहीं है कि भाई तू क्या लगा के आया है, इस टाइप की चीजें आपसे लोग ना पूछे. ठीक है, आपको कॉन्फिडेंट फील भी होना चाहिए, आपको कंफर्टेबल भी फील होना चाहिए. उस लिमिट में जितना ज्यादा लगा सकते हो लगा लो. एंड द फ्रीक्वेंसी डिपेंड्स अपॉन your exposure. If you are supposed to go out only once, just apply once. But at an interval of after an interval of 5 hours, if you have to go again, then reapply. For example, let's take a simple person who's having a job of 9 to 5. Okay, then apply it before going and apply it before coming. That's it. So you have to carry your sunscreen.
Carry your sunscreen in your bag, and when you go out, reapply it, right?
Yeah.
Okay. So this is like a small thing which people can definitely do. That they take sunscreen with them and reapply it whenever they are going out or exposing to the sun. And as the doctor said, कि इतना नहीं आपको लगाना है ताकि लोग बोले कि ये अपने चेहरे पर क्या किया. But yes, you have to apply it in a good amount, as Dr. Shafali suggested. And yes.
Here I want to add one thing, that ideal time of application is half hour before the outing, because sunscreen also needs some time to settle and gel with your skin. And a very good way of applying sunscreen is that before half an hour, because everybody knows that at what time they are supposed to go out. So it has to be inculcated in a schedule. So just apply one layer, and after 10 or 20 minutes, just apply another layer. See, it is something like you apply a lot of it. So it becomes like a mess on your face. कि अब क्या करें? एक होता है, you apply once. On the top of it, after 10 to 20, 10 or 15 minutes, just top it up with another layer. So it will feel more comfortable, it's settle better, and the amount will be more, and you will be able to apply the required amount of sunscreen.
Okay. So before going out, 30 minutes earlier, you should apply sunscreen. Doctor, we have Purvi Mehra, a viewer, asking, I have experienced significant weight loss in recent years. Is it because of premature aging?
See, significant weight loss has n number of reasons. And from depression to hormonal imbalances to many, not so unforeseen things. So the thing is that it is not because of premature aging at all. You have to get investigated why it is happening. It is not because of premature aging. Here we are just talking about premature aging regarding your skin. Okay, so any kind of aging in the skin cannot ever lead to weight loss. So I would really suggest that you have to get a proper checkup done why you are having a significant weight loss.
Yes, so please do go and visit a doctor if you are having a significant weight loss. Doctor, we have another viewer, Anamika Mishra, asking, is a high number SPF better than a low number one?
So here we have already discussed this. See, an SPF of 15 applied in a good quantity is good, but you can go from 15 to 50. I'll just repeat it once again, that when you apply an SPF, a sunscreen with SPF 15 in a good quantity, then you block something about 93% of the ultraviolet B rays which are falling on your face. Then if you go till 50, then that blockage amount becomes 98%. Now you can well imagine from 50 to 100, what is the window? 2%. But what is the increase in price? The price increase is substantial, because there would be people selling, oh, this is 70 SPF and what. And the difference would be just some points or maybe 1%. Again, the sunscreens with high SPF, they usually leave white marks. It is something like you apply, but you do not see that some whitening is coming. But when you are sweating, your sweat will be white. When you are laughing, your lines would be white. So it is very cosmetically unacceptable. So better is stick from 15 to 50. That is cosmetically good. It is affordable and it gives the maximum benefit. Don't go higher, because then you will end up in bad cosmetic consequences and throwing away a lot of money. And one more important thing, when the sunscreen is producing a lot of whiteness, then obviously you wouldn't be able to apply the required amount. That is, the application will be in a thin layer. Again, since it has not been applied properly, it will not fall. So it may be promising 70, but that 70 has to be applied in a good amount also, which you will not be able to do. So better stick to minimum, maximum 50. Don't go beyond that.
Okay, so 15, yani ki 15, so 50 is a good SPF level. You can apply it, and as doctor said, apply in a very good manner because that is also important. And we were talking about premature aging, and Tina Bhargav is here, a viewer, and asking stress can also cause premature aging.
Yes, obviously, stress can cause anything. I mean, if you are willing to read deeper what stress can do, it can actually cause anything on earth, any harmful thing it can cause, including cancers. So stress can cause a lot of premature aging, and the skin quality actually deteriorates in people who are totally stressed out all the time. And here we're not talking about physical stress. I am actually talking about mental stress. That a person, if he has a type A personality, हमेशा stressed रहते हैं, हर चीज की छोटी छोटी stress पालते रहते हैं, अपनी तो अपनी, दूसरों की भी पालते रहते हैं, सबकी stress पालते रहते हैं, then it is going to show on your skin.
राइट, तो स्ट्रेस फ्री रहे एज डॉक्टर सेड, बिकॉज उससे आपकी स्किन भी ग्लो करेगी, एंड काफी ज्यादा इम्पोर्टेंट है कि आप सभी लोग अपनी चिंता करें, अपनी स्किन की चिंता करें और स्ट्रेस फ्री रहे. डॉक्टर, here comes a very, we have seen in summers, usually girls and as boys also, they just cover up their face, put hand gloves on and they go. They don't apply sunscreen. So is it like that the clothes protects us from the UV rays, and why just not cover up with clothing instead of using sunscreen? Is it okay?
Yeah, it depends upon the transparency of the cloth. If the cloth is totally opaque, then a couple of layers, I mean 2 layers of cloth is enough, and it is a good way of protecting the face or any other part. So it just depends upon how transparent, see-through, what is the knitting of the cloth. It actually benefits. Yes, it does.
Okay,
and if it is used properly, it can actually replace the sunscreen also, but then it has to be used very diligently. It doesn't have to be that a single layer of one chunni, then it will not work. It has to be an opaque, well knitted cloth so that the penetration is also not much.
ओके, सो मतलब वो हमें सेव कर सकता है, बट प्रॉपर हम कह सकते हैं जैसे hearing and proper chunni. अच्छा, someone can apply sunscreen and the cloth and then they can go out. Will that also work?
That also works, but here, as you can see, there is you have applied sunscreen and then you are applying a cloth. So there would be a friction factor, which would also wipe up the sunscreen. See, these are practical things one should know. कि आपने लगा के रखा है, फिर आपका जो क्लॉथ है वो उस पे थोड़ा सा रब कर रहा है, तो इवेंचुअली वो रब ऑफ हो जाएगा. Okay, so it can work, but it will not be very complimentary.
Okay, definitely. So here is our next viewer, Suhana Thakur, asking, can sunscreen help prevent skin cancer, or it is primarily for preventing premature aging?
See, obviously, there are places, see, in Australia, and there is an ozone hole in Australia, and there nobody goes out without a sunscreen. Sunscreen is actually very, very important in preventing skin cancer, and it does a lot of things. That is from premature aging and to skin cancer. Yes. So it can be used in both the things. So there are certain skin cancers which get precipitated because of the ultraviolet rays. There are other skin cancers which are not precipitated because of this. So it won't help in that. In the cancers in which ultraviolet rays are instrumental, it will help.
Okay. So
but just one more moment. In India, skin cancer is not very prevalent because of ultraviolet rays, because of the skin type we have. Okay, this point is relevant in places where they have a type 1 or 2 skin, which is very thin, which is very white, who get freckled very easily. So these things are important in those people. In Indians, we do not see skin cancer so easily.
Okay, but it is always better to apply sunscreen for your good skin. Like, because we usually ignore it, applying it, but one should definitely apply it. Doctor, there is our viewer Deepak Saxena, and he's asking, how can I protect my baby or toddler from the sun?
See, basically, depends upon how much outing your toddler is doing. I mean, toddlers are so well protected that hardly their faces are visible. So don't psych out so much, toddlers by default, they are having such a good growth of everything in their body that you do not need to be very protective for the toddlers. Okay, and he wouldn't be obviously crawling around on in sun and all. और अगर वो करता भी है तो कोई issue नहीं है. He is a toddler, let him be. We are talking about people who are more than 20 years of age.
Yes. So, Deepak ji, you can be assured that if your toddler is going out, let it be. Doctor, there is a viewer question, Shania Sen, asking what are the best practices for applying sunscreen to the face and body?
Yeah, so the best practice is first, remember that you have to apply. This is something everybody forgets. So make it a routine and apply it 30 minutes before you're going out. And as I said, apply in 2 layers. Apply 1 layer in an ample quantity. When you're okay with it, apply after 10 to 15 minutes, apply another layer. Then you can apply more on the parts which are enduring friction. For example, your limbs, upper limbs, etc. Never forget to apply on your back if it is exposed. Then carry your sunscreen. Put an alarm for after 5 hours because it is very easy to forget reapplying the sunscreen. So apply it after 5 hours. That is it. And if you're going in a beach destination, if you're going on a holiday, you're going to Goa, a beach destination, then always carry a sunscreen which is for swimming or which is for sports. That only works. No sunscreen works there.
Okay, so as phone is important when you go out, phone is important. Please carry your sunscreen as well because that is also important for you. Doctor, as you know, people usually apply sunscreen in the summer season, and now we have already hit monsoon. So is it like that? That only in the afternoon time or the summer time we should apply sunscreen, and in the other season we should not apply it?
No, not at all. Like we can't go out without clothes. We can't go out without sunscreen when during between sunrise and sunset. It is something like that. If you want to take care of your skin, then do apply. It's raining, it's windy, it's cloudy. Only when the sun has set, do not apply it. But when it is between sunrise and sunset, make sure that you apply it. Because see, we're talking about ultraviolet rays here. We're not talking about the visible light or infrared. What you feel on your skin, आज तो गर्मी लग रही है धूप में, तो वो infrared होता है. It's not ultraviolet. Okay, so ultraviolet spectrum is not felt. It is the damaging thing, and it might get reduced in these days when there is cloudy, when it is rainy, but it is nevertheless always present. So you have to apply, come what may.
We were discussing about it only, and we have a viewer question. Faria asking, is sunscreen necessary on cloudy and rainy days as well?
So that answers it, I guess.
Yes, Faria, you have to apply sunscreen on any day, like rainy day or cloudy day, because we are talking about the UV rays here, and it is best that you should apply sunscreen. Doctor, when we are talking about sunscreen, premature aging, so if one have not applied sunscreen for many years, but recently they started sunscreen, so will that can prevent them from premature aging?
It's something like that कि जितना करोगे उतना ही मिलेगा. Okay, so suppose we're talking about investment. There is a person who has started investing in since they were 20 years of age. So their investment would show when they are 35. In 15 years, a good dividend is available. But there is a person who started investing in after 45 years of age. So sunscreen is kind of an investment. It is not something that you apply and instantly it gives results. आपकी skin चमकने लग जाती है, आप ये हो जाते हो, वो जाते हो. No. It is not this. Aging is basically a cumulative assault which happens on the face. Cumulative assault का मतलब है over the years. धीरे जो चीज होती है, sunscreen उसे prevent करता है. It is not an instant छूमंतर type of a thing. Magic हो गया. आप अगर आज लगाना शुरू करते हो तो आपको डिविडेंड्स 5 साल में, 4 साल में या 10 साल में दिखेंगे. आपकी स्किन, आपकी जो पीयर है, जो नहीं लगा रहे हैं, उनसे थोड़ी सी बेटर दिखेगी. इज द थिंग. सो मतलब आप अगर लगा रहे हैं तो यू शुड बी नोइंग कि वो करने क्या वाला है. सो यू कैन स्टार्ट इट एट एनी एज. ओके, एंड वट एवर यू डू, इट विल स्टार्ट वर्किंग, बट द रिजल्ट्स विल बी visible later.
Right, definitely. So you should apply sunscreen as soon as you are aware that applying sunscreen is good for your skin as well. Doctor, what else should we know about sunscreen, and what else can we do to protect ourselves from the sun?
See, sunscreen में एक और चीज होती है which is never talked about. There is something called PA, and it is done as a rating. PA plus plus plus, PA plus plus. So these are the amounts of pluses, and this ranges from 1 to 4. So as I told you that the UV rays, ultraviolet rays are of two types. There is A and there is B. So we have been talking about B when we had been talking about SPF. Now this PA factor is actually talking about A, ultraviolet ray. That is also important. So if there is an opportunity to choose, always try to look for both of these things. The SPF, which is the sun protection factor because of in concern to ultraviolet B, and also the PA. It is written in small letters, and see how many pluses it is. The more the pluses, which can go maximum out to 4, the better it is. Okay. And a foolproof way of getting protection from sun is umbrella. Carry a very opaque sort of an umbrella. This beats the sunscreen. Okay, that is it.
Okay, so these are the things which you have to keep in mind before going out and exposing your body to the sun. Doctor, before we end this valuable session, any takeaway message for all our viewers who are watching this live right now?
Yeah, I would like to say that, see, everybody wants to stay young. Okay. And okay, not stay young, look young is the thing. Whatever they feel inside is actually immaterial. They should project that they are looking young, is what everybody endeavors to. Okay, and it has two sides. Well, it has two parts. One is what you apply, and one is how you live. Okay. So yes, sunscreen is very, very important. It is one of the only important cosmetics which should always be used. And there is something called healthy lifestyle. So a healthy lifestyle, if the lifestyle is not healthy, you just bath in sunscreen, nothing will happen. Okay. So both of them will go hand in hand. ऐसा नहीं है कि कुछ भी कर रहे हैं लाइफ में, लेकिन सनस्क्रीन लगा रहे हैं. Okay, and you think that is the remedy to all. ऐसा कुछ नहीं हो सकता है. तो everything is a holistic approach. You do not want premature aging. Then everybody knows what is wrong for health, what is wrong for skin. Whatever is wrong for health is actually wrong for skin. The nutshell. Okay, so you can just not do that, and you can actually retard the rate of aging. That is what I want to say.
Okay, so whatever you are doing, do like have a healthy lifestyle, as Dr. Shafali suggests, and apply sunscreen. Take a note from today's live session that applying sunscreen is very important. And thank you so much, Dr. Shafali, for your valuable time. It has been a very informative session for our viewers, and it is great to hear you.
Thank you. Thanks a lot.
And we really look forward for many more such sessions in the coming time as well.
Sure, I also.
Thank you so much, Dr. Shafali, and thank you to all our viewers for excellent participation for today's session. And stay connected to our beautiful Spotless Skin page. Thank you, and good day to all.